Welcome back to the PA Mastery Method. Here we are going to do part 5 of the surgery topic list for the PA EOR exam. This is going to be a Q&A style video, so make sure you try to answer the question before I provide you with the answer. Alright, here we go. What is the diagnosis for a 2-year-old with painless rectal bleeding? It's going to be Meckel diverticulum. How can you tell the difference between large cell lung cancer and versus the adenocarcinoma? LCLs are much more rare. They also have necrosis and are faster growing. Adenocarcinomas are more common and they have a spiculated border. What is Cowlett's triangle? It makes up the cystic duct, the common hepatic duct, and the cystic artery. This is a location for surgical interventions within the biliary area. What is the most common exam finding with pancreatic cancer? It's going to be painless jaundice. Which labs help confirm testicular cancer? It's going to be alpha fetoprotein. Which electrolyte abnormality can cause post-operative ileus? Hypokalemia. If a patient has cholangitis, what is the first step in treatment? First, you're going to give IV antibiotics, and then we're going to go do an ERCP. This is both a diagnostic and therapeutic if there are stones present, which have caused the cholangitis. And then if that is the case, we can do a laparoscopic cholecystectomy. What is the initial step in treating a surgical site infection? We're actually going to explore the wound. Going to reopen it and debride it. What is the common treatment for a seroma or hematoma less than 2 centimeters? We're going to just do expectant management. The body should be able to get rid of these issues on its own. Remember, hematomas are more blood clots, seromas are just more of like a yellowy serous fluid. What is the most sensitive test for acute cholecystitis? It's going to be a HIDA scan. Why might a patient have referred shoulder pain after a lap chole? This is due to carbon dioxide insufflation. What is an absolute indication for initiating dialysis in CKD patients? So if we see uremic pericarditis, we need to do dialysis immediately. Which anesthetics are amines and which ones are esters? So I think amides always are going to have the 2 I's in them, so stuff like lidocaine, things like that. And esters just have 1. What is Eisen-Menger syndrome? So Eisen-Menger syndrome is a complication from an unrepaired congenital heart defect. How do you diagnose Paget disease of the breast? Going to do a punch or full thickness wedge biopsy. What is the root cause behind a hollow jolly body? This is due to someone who has a splenia or some kind of splenic dysfunction. What is going to be the difference between Horner syndrome and a Pancoast syndrome? So Horner syndrome is going to affect the face, think ptosis, meiosis, and hydrosis, and Pancoast syndromes are going to more affect the arm. When do you use octreotide versus propranolol for esophageal varices? Octreotide is for acute, and propranolol is for prevention. If a patient has low potassium, what other electrolytes need to be checked? So always go and check their magnesium. Magnesium and potassium are going to go hand in hand. What do thioamides do? These are your methimozoles and your PTUs. The thioamides will block thyroid peroxidase, which prevents iodine oxidation. What is the next step after acute diverticulitis flare-ups? Wait about 6 to 8 weeks and then follow up with a colonoscopy. How does biliopancreatic diversion surgery help a patient? It is a weight loss surgery that causes malabsorption. What is the first step in treating gastroparesis? We need to approach with a low-fat, low-fiber diet, and then if still refractory, use metoclopramide. Which electrolyte disorder occurs in anorexia with refeeding syndrome? They're going to have hypophosphatemia. What is the most common infectious cause of toxic megacolon? This is going to be C. diff. Alright, that is all for now. Don't forget to subscribe.